Hi, everyone. My name is Frank DeFerrio III, pharmacist here in Waterbury, Connecticut at Della Petra Pharmacy. Um, Talking to Karen in Northeast Pharmacy, we are, so far as we know, one of two pharmacies in the state of Connecticut, independents, who have been granted and authorized to dispense the COVID vaccines for the time being. And we kind of wanted to begin discussing with everyone else what they need to be working on, what they should be trying to do at this time, and giving you a little bit of insight into how CTwiz, VAMS works, as well as the normal workflow that goes along with doing the COVID vaccine clinics inside of the pharmacy, and going from there, how you should hopefully try to run yours. Obviously, everyone's going to be different. Everyone's going to want to do it a different way, but giving you a little insight in how we did ours and what changes we're going to implement into doing ours further into the future as we go along. Just some disclaimers. There's no commercial bias in regards to the information I'm showing and detailing you today. My pharmacy software might be different from what you use. We use NRX with QS1. If you use a different pharmacy software, please contact your software vendor to make sure that you can do all the things I am showing and detailing to you today. This is an educational, informative program to help other independent pharmacies. Basically, you can watch the video, you could take what you want, you could take what you don't want. It's up to you with the information I do give you. Hopefully it can be helpful. Hopefully it is going to shape and change how you think you're going to run your clinics when you get your COVID vaccines. And one last piece of information, I am located in Connecticut. Every state, town, or jurisdiction might have different rules depending on where you practice. I know Northeast Pharmacy Services is throughout the whole New England area. This might be specific for the Connecticut pharmacies here, but hopefully as we continue to go through this process, other pharmacies can watch this and at least take bits and pieces of information and go from there. Lastly, I'd like to thank the Northeast Pharmacy Services staff, Dave Benoit, Pat Monaco, Karen Heckler, and Kevin Hill. They've been doing a tremendously great job doing and helping us navigate through all this. I know Karen and Kevin and Pat and Dave must get 1,000 phone calls a day as to what we should be doing. And next time you see them, definitely give them, a big thank you for what they've done so far for us. They're continuing to work for us every single day. And without them, we probably wouldn't be where we are right now at this point. So without further ado, we are going to start working into the CTwiz, and then we will work through VAMS, and then I'll show you how to do some billing, and then I'll answer some questions Karen gave me today, and we'll start from there. All right, for some of you, this is what CTwiz looks like. This is the state of Connecticut's immunization information system that allows pharmacies, healthcare providers, anyone who is immunizing to upload patient data, submit that to the state of Connecticut for data logging purposes. Basically, this is just the base opening page. You'll see here, you're the provider, you will be your name. Ours is Della Petra Pharmacy. We're the clinic Della Petra Pharmacy. Up here, it'll say that same information. This number here, this is your IIS PIN number. This PIN number will not be open or accessible until you have completed your COVID-19 enrollment and submitted that and have been approved. So until you do that, you will only see the Della Petra, you'll only see your provider name, your clinic name, and that's it. Until you submit your CTwiz COVID-19 enrollment, this PIN number will not be accessible. You can call the CTwiz support line, but they may or may not give you that information because you have not been approved. So when you first get into CTwiz, the big thing you need to start working on is going to create your CT COVID enrollment. And what that is basically you go and create add enrollment templates, COVID vaccine program enrollment. And what you'll do is basically that CDC chart that was given to us at the beginning of all this, you need to start filling that out in order to get an approval. Until you do that, you will not be invited into the state program in order to get into VAMS, in order to get shots. So that is the key thing you need to do. In addition to that, the CTwiz will also ask for 2 continuing education trainings. The first one is called You Call the Shots Module 10 on the CDC website. I'll leave that here for people who want to take that down. Follow the steps to getting this credit done. You will need to upload it for not only this, but your federal partner with whatever that may be, if it's CPSN, if it's HealthMart, whatever federal partner you're using. They will require this to be a training that all pharmacists or all people who are going to be involved with the vaccination have to complete. The second one is the Moderna EUA. And as we go along, you're probably going to have to continue doing this for all the other vaccines that do get approved, such as AstraZeneca, Johnson & Johnson. You will continuously need to show and get these credits from the CDC and enter them into the CTwiz. So when we go into CTwiz, you're going to go to clinic information, staff. You need to have 2 people registered inside of CTwiz, from what I was told, to create and be able to sign the agreement along with the COVID enrollment. When you're inside, you're going to need the basic information, chief executive officer, physician signing the contract, filling out the rest of this information, and then you add your training in at that time. Until you do that, the state of Connecticut will not approve your clinic. That is important. If you want to get approved for your clinic, you need to fill out your COVID-19 enrollment, and you need to do those 2 trainings and then continuously do additional trainings as the vaccines get approved throughout the year. One of the key things you should also try and do at this time is, in order to enter a vaccine into CTwiz, it does take time, probably 5 to 10 minutes. And if you're running a clinic, you will not have time to do that. Contact your software vendor to see if they can automatically, at the end of the night, similar to the PMP, pull that information, submit it to the CTwiz, and let them distribute it into the system. That would also require you to make sure that you are onboarded in order to do that. The software servers will allow, the pharmacy software will allow you to submit the data, but unless the system itself knows you're submitting it outside, it will only sit there and it will not pick that information. So you need to make sure you contact CTwiz or the onboarding services in order to say you're doing the vaccine clinics, you need to be onboarded and you need to be integrated in order for that to happen. If not, there is supposedly going to be a fine if you do not submit those within 24 hours of vaccinating. At that point, you should hopefully get an invite into VAMS, which we will discuss going into the next section. All right, so once you've been approved with CTwiz and you've gotten this far, the next step is you're going to be asked to be invited into the VAMS system in order to help vaccinate at the time. And obviously at that point, you would want to say, yes, I want to start vaccinating as soon as possible. From here, you'll be given 2 portal accesses. For some people, they've already accessed VAMS for the organization portal when they registered their business with the pharmacies in order for their staff to get the COVID vaccinations. Now we are going to focus on the clinic portal, which is basically registering your clinic, managing your vaccine appointments, and logging your vaccines. Once you click access your clinic portal, 2 clinics will pop up. We're going to mainly focus on this. The clinic on the left is going to be your standalone address for that clinic. We do not really know exactly what the third-party clinic at this time will be for. There probably is training for that with VAMS, but we're mainly going to focus on the main clinic. So here you can see this is the main clinic portal. This is how you're going to manage your appointments, check in, create your scheduling, your treatment stations, everything like that. The VAMS clinic portals work via email address specifically. They do not work by name and date of birth because of, I'm going to assume, too many continuity errors between people's names, date of birth. It works specifically via email, and only 1 person can be attached to an email. Mr. and Mrs. Johnson cannot have the same email. The system will not allow that. So your patients who are over 75 who have 1 email address, they will need to create a second email for the wife, for the husband, in order to be registered and create their own appointment in VAMS. For people who are registering their mom and dad, if they do not have an email, just tell them to go onto Gmail, create Mr. Johnson 304 at gmail.com, Mrs. Johnson 304 at gmail.com, and let them create their appointment that way. Husbands and wives, partners, anything like that, they cannot use the same email to schedule their appointment. From there, you're going to work on creating your clinic setup, making yourself available for scheduling. You'll have all this information already inputted in here. You'll change your start and end date. The key thing in order to create your scheduling is you have to make yourself available for scheduling. You're going to click that tab here, available for scheduling, and then save it. And then also making sure that you are also making your operating hours available. Once you make your schedules available for scheduling and you set your operating time slots, you are more or less ready to start. The problem is, do not do this until you receive your vaccines or the vaccines are in the store. When we first started, our first delivery was this past Monday, January 19th, Martin Luther King Day. We were told we were going to get the vaccines on Monday. They did not arrive until Tuesday, and our first appointment was at 10 o'clock. Our vaccines didn't arrive at 9:30. Make sure you give yourself time to get the vaccines, get familiar a little bit with VAMS before you jump right in. So I know I'm kind of running through VAMS, kind of glossing over a lot of key factors that you might be concerned about, treatment stations, all these other tabs. One great resource, if you go onto YouTube, just type in, this information, VAMS clinic setup and scheduling demonstration. It is a great resource and great tool in how to create a scheduling via VAMS, creating treatment station absences, times for yourself to create a lunch break, get some of your own work done. There's also these other two on the side, end-to-end demonstration, opening up your clinic, getting everything set up, how to run a day. You're welcome to VAMS clinic users, similar. It's all similar information, but it's great information. This is probably something, the week before or a day before you want to start your scheduling calendar. This is something you should watch in order to make sure you know how to create your schedule and kind of control your schedule as well, because I'll talk to you a little bit about that as we go along. In order to create or get inventory, it needs to be done via VAMS for the time being. What you'll do is you'll go to inventory requests and hit new. I've already created an inventory request today, but I'll do a demonstration one for you. Currently, they will only give you, you could click recent vaccines. We'll be looking for Moderna. Date requested will be today. Dosage requested will always be in boxes of 100. So you can never order like 150, 120, 130. It always needs to be 100 because that is the state's minimum order you can receive. Date required by, you always want to go to the following Monday. The state of Connecticut, with the way VAMS works in ordering, requests that all orders through VAMS for the following week need to be submitted by Wednesday at 12 p.m. If you do not send your order by Wednesday at 12 p.m., you will not be guaranteed any vaccines if there are any left. At this point, you're just going to hit save, and it'll update the page. And if you want to be notified via email, if you're going to be getting it, click follow, and they will email you if you receive any message about this inventory request. If it's a denial saying you're going to get 0, if you're going to get 100, that will tell you what you're going to be getting in that email. You can also go here, and it will alert you as well as to how much you'll be receiving. I strongly suggest everyone watch that video I just showed you in the beginning. It's full of great information. It's really helpful in creating your scheduling, and it's also super informative, and hopefully you can avoid the mistakes that we made, which I'll explain a little bit further as well, and just kind of getting through that. All right, so this last part here is basically what happens when you get your inventory for your COVID shots.
what'll happen is UPS will drop off your inventory. You'll get it in 2 different boxes. The first box contains your COVID shots inside of basically a freezer tote with about 7 or 8 ice packs that are in there. The second one contains your syringes, needles, face masks, shields. No gloves come with the alcohol wipes. All that stuff cannot be sold. That's one of the key conditions. You cannot sell any of those needles. You cannot sell any of those syringes, face masks, shields, anything like that. You will void your contract at that point. But basically what you need to do when you get your inventory, obviously get it as soon as you can, put it into your freezer or your fridge, wherever it needs to go, and we're going to start logging it. So when you get your UPS package, open up your freezer tote. Inside, there will be a little button card in there. That button card will basically have a green arrow and a red X on it. You need to look at that card because that is your main electronic tracker to determine if the shipment was received and sent properly with the temperature reading. So basically it's a way of knowing, and UPS knowing, and everyone knowing that you received your shipment without any temperature excursions. You're going to take that card out. You're going to hold the stop button in the middle. If it's lit to the green side, if it's lit to the red X, you're automatically going to call your state or your federal partner and alert them that you received a shipment that was out of temperature reading. Once you do that, you're going to put it into the fridge. You're going to manually log your inventory in VAMS. You're going to hit manually log inventory. You're going to choose the manufacturer, your vaccine. You need to choose the NDC, and then you're going to choose your 2 different lot numbers. The ULS lot number is the unit of shipment, which is basically your vial, the box lot number. Then you're going to choose a vial, make sure those 2 match. If those 2 things don't match, then you're going to automatically have to call your state or federal partners to let them know that you got a missed shipment. To find your expiration date, you're going to go into Moderna vial expiration date lookup on the Moderna website. You're going to type in your lot number there, and it'll give you your expiration date. So that's how you find where that is. It will not say it on the box. You have to manually type it in to find it. You'll enter your expiration date in, you'll hit next, you'll review, and it'll pop up there on the VAMS clinic. So when you go into inventory management, it'll say, here's how many scheduled shots, here's how many on-hand doses you have. So it'll alert you to say, do you have enough shots for those doses? Obviously, this will be a running total because this is the next 28 days. And as you give shots, the doses will go down. A second place you have to document is this website called COVID Locating Health. This will be either provided to you by your state or your federal health partner. You have to go into this every single day in order to create or log this inventory. This is part of Vaccine Finder itself. You could do it one of 2 ways. You could download an inventory spreadsheet, or you could just log it manually. Very simple. This will pop up originally with Moderna and Pfizer. You just hit edit. New doses, you type it in and submit inventory. That has to be done every morning before 12 p.m. and it gets updated for the next day. So basically, Monday, it'll say that you received 100 shots. You know, the next day when you go in, it'll update to 80. So basically, there are multiple places to track how many shots you received, where you received them, and when you received them. So this is how you're going to document, load into your inventory into VAMS, as well as COVID Locating Health, as well as to find your expiration lot for your Moderna vaccine.
All right, so at this point comes the fun part where you actually get paid to do something. Like I said earlier in the presentation, I use NRX with QS1. Obviously, just kind of follow along. You don't have to do exactly like I do. Every system is different, but here's how you're going to be able to do the billing for both Medicare and commercial insurances. I'll be using my name and my profile in order to show you how to do that. So first and foremost, what you need to do is you need to enter in the drugs themselves. So you should have 3 different Moderna drug informations. The first one is going to be the drug with the vaccine, which we'll show you here. and just let your system fill this in. If you know, here's the NDC listed, that's easily accessible online. Just go through, make sure it's updated and everything like that. It's not a problem. This will be for your commercial insurance and your Medicaid, the Husky State of Connecticut program billing. You're going to use this NDC and this information in order to bill for the COVID vaccine. For Medicare Part B, you are going to be using HCVIC codes and billing it similar to a flu shot. All the 2-shot series will have 2 HCVIC codes. If you want, please copy this information. You're going to just type something in simple like Moderna COVID-1. This will signify the first COVID shot, size 1. Your state code is going to be 0011A, and it's going to be an 09 for HCVIC code. When you go to bill the second shot, you are going to use Moderna COVID-2, whatever you want to label it. Your state code 0012A, and your code, once again, is going to be HCVIC. Make sure your system can transmit this information into EZ or whatever Part B biller you're using. This is going to be ensured that you're going to get paid and you're going to have those claims approved as soon as you bill them. So running through commercial insurance, we'll use my name at this time in order to bill the shot. So you're going to go to New RX. One of the key things, you are the provider yourself. You need to make sure you have an NPI in order to bill for the shot. If you are already Narcan approved, you have an NPI. Great, amazing. If you are not Narcan approved, you need to work on getting your NPI and registering it as a pharmacist. So you're going to go in. We're going to use our commercial billing claim. Create yourself an easy COVID reminder, 0.5. Okay. So at this point, you're more or less going to go in and bill it as if it was a normal pharmacy flu claim. You're going to go in, you're going to add your incentive fee. It seems like you shouldn't enter an incentive fee. The insurances will not take the COVID vaccine claim without that. They need to see something in there as an administration fee. You could put in 100, 1,000, whatever it is. It will not take that administration fee. It just needs to be there for a placeholder so it can see it being billed as a vaccine. When you're doing your billing for your first shot, you're going to go into your submission clarification code and go O2. The O2 signifies the first vaccine dose. If you're doing a second vaccine dose, you're doing 06 to signify that this is the second shot. I know it's a starter dose. This signifies to the insurance that this is the second shot that you're going to be giving is an 06, but we're doing our first shot, so we're going to use 02. We're going to save. We're going to fill. And then here we have our paid claim. This should come to $16.98. It's not going to, you're probably not going to get paid that. That's just what it is. But you will always make sure, going forward that you're going to use the 02 and the 06. 02 is for your first claim. 06 is for your second COVID shot. Now, let's say you have a Medicare patient come in. No Medicare Part D claim for us here at Della Petra's has paid for the COVID shot. You need to make sure when these Medicare patients come in, you are getting their red, white, and blue card, or if they don't have it, getting their Social Security number and running an eligibility claim to get that number or that information. Without it, you can't bill for that shot. So similarly, when we're going to be billing our Medicare Part B plans, you're going to be using the same processor as your flu shots. You're going to enter in the policy ID number, their cardholder status, the patient residence as home and location as home. You're going to go back in, we're going to, let's just say we got to this point here. Your authorized quantity is 1. Your dispensed is 1, similar to a flu shot. Your Y1 is going to be here. Your claim information is going to be a Z23. No, Z. For encounter for immunization. And then all codes, because we're using HIC-VIC codes, are going to always be O2, other override. If you don't put that in, it will probably come up with an error message saying Medicare Advantage plan, or it'll say flu shot already administered, because the EZDME cannot distinguish between flu shots and Moderna based off of HIC-VIC codes. It needs something in there to push that override through. So as you see here, we are no longer billing when you're doing a Medicare Part B claim. We are not using our NDC drug. We're using our Moderna COVID-1 because we're using our first shot. And if it's a Moderna second shot, it's a Moderna COVID-2. So we're going to use our Moderna COVID-1. All of our information is here. We need to make sure that we're billing it under the vaccine profile, and this will get you a paid claim. In regards to EZDME or whatever your third-party billing service for your Part B claims are, do call them ahead of time because they might deactivate you once you start billing for COVID vaccines because they will not know that you're doing it. Our second day, we were finally able to bill for the Moderna vaccines with our Part B claims. The next day, that Thursday, we came in, they had inactivated our NPI with the EZDME, and we had to call them and get reactivated, which is just more time being wasted on the phone. Call them ahead of time to alert them that you are going to be doing COVID vaccines and not to deactivate your NPI through EZDME. So one of the key things that we also need to focus on after we do our billing for the shots is we need to make sure that this information is going into CTwiz somehow, and that with our NRX QS1 system is going to be found in our immunization record. You have to kind of weigh how many shots you're going to do. I believe QS1 charges $40 a month or like $2 a shot. You're obviously going to be doing a lot of shots, hopefully. So I would suggest you do whatever is more cost effective for you. That's up to you to decide. But basically, in order to get this information into CTwiz, we need to fill out an immunization record. Make sure whatever software vendor or server you're using has this capacity or ability to do this. We're going to look here, we're going to need to fill in all these star information. So for immunization type, if you look here, there is no COVID vaccine that's currently available. You're going to do other immunization field will print. That's here. Your manufacturer is Moderna, 0.5. You're going to enter in your lot, your expiration, your administration site, your left arm or right arm. Your administration route is going to obviously always be intramuscular. You're administered by, you're going to make sure you have your name or whoever administered it in there. And once all those fields are done, provide the patient or guardian a written record of the vaccine. You're going to hit submit. And this will allow the software service to pull that information and submit it back into CTwiz. The immunization record does not have to be done at the time of billing. That could be done later on. If you want to do it at the time of billing, you can. That's however you want to do your workflow. It's up to you. We do the billing first, and then we enter it in the immunization record, and we submit it, and it always does take. But like I said, you need to make sure that you're onboarded and uploaded with the state of Connecticut CTwiz, because remember, we're trying to avoid that potential fine that they're trying to do. So make sure you're on board and make sure these are submitting properly. If they are not submitting, you need to make sure you go back into CTwiz and manually enter them in as you go along. All right, so a lot of these things that we're seeing here are some things to consider when you're setting up your clinic, doing your clinic, and moving forward with your clinic. So we're going to start with the VAMS side, and basically the first question you should ask yourself is how many shots you want to do per day. The Moderna vaccine is very easy to use once it's thawed out. You draw up all 10 shots, but those 10 shots have to be used within 6 hours once you have gone into the vial. So you kind of need to time your shots around that. You need to figure out, how many shots am I going to do a day? How many shots should I get prepared at a time? Because if you're going to do all shots within a certain time period and you need both those vials, then just take your 2 vials out and draw them up and go. If you're going to do your shots from, 10 to 2, and then you're going to go back in and you're going to go from 6 to 8, you need to figure out how you're going to get those vials thawed, drawn up, and stored in order to keep them viable. In the pharmacy world, we do not like waste. Try not to lose any of these vaccine doses, because these vaccine doses are free money for you. You don't want to be leaving money on the table. You want to continuously make sure you're saving and doing what you can do. Another question that she's been getting a lot, and what we've seen, was we had a lot of patients we have never seen before from all different parts of the state. When you open up your scheduling, you are available and open to anyone coming into the store that has been registered in VAMS, has a lot of valid email, can come in and get their shot as long as they're in the group that's qualified. This past week, we had a husband and wife that drove all the way from Westport. We had a husband and wife who came in from Roxbury. We had a husband and wife who came in from Clinton, Connecticut. You will never see these patients again, and that's okay. But you also have to kind of weigh how you're going to do that versus your own customers. You can create a schedule that works best for you. Say you want to do shots Tuesday, Wednesday, Thursday, Friday. Those can be your scheduled clinic hours. You could do walk-in appointments. If you go back into VAMS, you could see the create appointment tab. If they have registered in VAMS, you can type in their email address and create them as a walk-in appointment. But you have to remember, you have that 6-hour window, and some people are not able to immediately come in. You might be calling some of your own customers. You should probably get a list or tell your own customers what your plan is to get them vaccinated, because you don't want to turn away your regular customers. On the VAM side, who was qualified? If you've read the paper this week, the state of Connecticut had a little issue with the school districts being entered accidentally too early. So what needs to be done? The state of Connecticut has been really good communicating with the pharmacies in regards to who should be getting vaccinated, who should be our focus on. They will send you an email almost every day, every other day, with any adjustments or changes within the VAMS system. VAMS right now should be more operating at what they want. People who are registered and are not qualified at this time to get the shots will not be able to sign up for a time slot. As we move forward, they will probably adjust that. The school district should be open to getting shots at some point, and then you're 65 and older. But right now, for what we know, the only people who are eligible to receive their vaccines are your essential workers, the people in phase 1A, and your 75 and older population, which is what we saw moving forward on Friday. Those were the only ones that were there. Is it required for scheduling with VAMS? Yes and no. Like I said, you can create walk-in appointments, but remember, once you go into that vial of Moderna, you have 6 hours to get rid of those shots. You need to be conscious of that and making sure you can get those 10 patients in there within those 6 hours. If you need to do a schedule for VAMS, the people will sign up. People will sign up for your clinic no matter where they go. Like I said, Roxbury, Clinton, and Westport came in. You will have people who from all parts of the state who are looking for the vaccine. The slots will fill up. It is up to you to decide what is best for your store in regards to who you want coming in, if it's your regular customers or if it's people you want just coming in as a walk-in to get their shot. So in regards to workflow, some of these things are very similar to the VAM system. The key thing I cannot stress enough is you have to know how many shots you want to do per day. We are small independent pharmacies with maybe 2 to 3 people who can immunize. We are not supposed to do 300 shots per day. This is not like a flu shot clinic where you're putting the needle in the arm, you're billing it, and you're telling them to go home. This is very labor intensive. You need to document that they're there. You need to document the pre-vaccination questionnaire. You need to get their license. You need to get their information. You need to do a lot of work. You need to vaccinate. You need to document in 2 to 3 places how the vaccine went, what arm, what it was, and then they have to wait for 15 minutes if they never had an allergic reaction, and then 30 minutes if they have. It is very labor intensive, like I said, and you need to figure out what your schedule is going to be. If you have enough support staff to work the bench and answer the phone calls, then you could do 30 shots. I'm not telling you what you can or cannot do. I'm just letting you know this is what we did. 30 shots was a lot for a small independent pharmacy like us. And I did not work any bench. I did not type any prescriptions in. I did not answer any phone calls. If you need to be in that dual role of answering and working the bench and doing the vaccines, you should start with 10 shots the first week just to get a workflow pattern going. Then go to 20 and see how you do with that. Your support staff is going to be key in the success of running these clinics. I had a pharmacy intern who was with me for the week, who was doing the typing, the patient entry, scanning the licenses, scanning the insurance cards. She was great help. I'm going to miss her because she had to go back to college. But, you have to find and adapt to changes in your staff and pulling who you need and what you need. If you need someone to enter in the patient information, do that first thing in the morning. If you need someone to take the licenses, have someone designated to do that. Have your staff help you because you're going to be too busy with other things, especially if you have back-to-back appointments, getting from one person to the other and billing these things. In regards to who can get the shots and when, back to the state communicating directly to you. If they can get into VAMS, at this point, they should be eligible no matter what. You're going to do the shot, but to verify their information. If they are a school teacher, the email address will say, typically Fairfield Schools, Waterbury Public Schools, anything like that. They are not allowed to get their shots currently at the time of this recording. If they are 75 and older, yes, absolutely, they can get their shot. The key question I received, some of these patients might be snowbirds. If you are getting your shot in Connecticut, you need to have a Connecticut license and reside in Connecticut. If a snowbird comes in with a South Carolina driver's license, they are absolutely not allowed to get their vaccine. If they say they want to go to South Carolina and get their second one, tell them they may not be able to register. Every state is different, but at this point, that we can only say they should be allowed in Connecticut, and that's it. Storage and thawing, just keep an eye on the clock. Get yourself some timers. I went to Walmart. I got 3 timers. They were $1 each, just for the purposes of timing people with the vaccine. You don't want to accidentally lose track of time and someone's been sitting there for an hour and then you tell them to go. The thawing out, you got to wait. If you're going to take the Moderna shots out of the fridge and just let them thaw at room temperature, it takes an hour. If you're going to put them in the fridge, it takes 2.5 hours. You have to make sure you have all that information written down somewhere so you can track it. And then once you go into that vial, you got to make sure you use those shots in those 6 hours or else it's gone. You cannot use it. Like I said, it is very labor intensive. From documenting in 3 different places. You got to document inside of VAMS. You got to document inside of your service, pharmacy service. You have to document on the paper prescription themselves. It is very labor intensive, and you need to make sure you can handle the workflow. Do not jump in to do 30 shots. I would never recommend anyone do that, but you have to decide what's best for your store. Start off with 1 vial, 10 shots the first day. Just do walk-in clinics for your own customers. Then open up the VAM site. Then, slowly integrate. If you could do 10 and you guys feel like you have a good workflow, work up to 20. If you said 20 is too easy for you, I wholeheartedly will tell you to do 30. You could do whatever you want, but just make sure you can handle the workflow as you go along. I want to thank you guys very much for, hanging in there, listening to me talk for, I don't know if it's 35 minutes, 40 minutes, however long it is. If you have any questions, feel free to reach out to me at Della Petra Pharmacy. You can look us up. Our information's online. Give us a call. If I don't answer, do not be mad. I'm probably doing COVID vaccines, or I'm on the road doing something pre-port for a patient, or I'm just busy doing something else. Write your name down. Tell them what pharmacy you're from. Any questions you have, I'll be more than happy to answer them. Use your resources. Remain patient. Do those training modules that you can. Keep up with any paperwork with your federal partners that you're currently working with now. Hopefully we can get through this phase 1A, 1B, 1C, and we can get our federal partners a little more active. They will be kicking in phase 2 from what we know. We don't know what will change in the next couple of weeks, but hopefully this information stays continuously relevant as we go along. If we need to do updates, I will talk to Northeast and we'll see what can happen. Any questions, feel free to reach out to me. Once again, our information is online, and I'll be more than happy to help you guys out. Thank you very much, and hope you enjoy the rest of your time.